dear colleagues. Thank you for coming here today. On this book talk, I will talk about how the Ngenuity visualization system might bring us beyond the borders of the analog view. So here are my disclosures. I'm a paid consultant for Alcon, and this is the first and most important slide of the presentation, where you can imagine how we can go beyond the borders of the analog visualization. We will talk about the reduced risk of retinal phototoxicity, and here is the moment where I can invite you in the lunch symposium, where we will touch more on that when I will discuss the illumination technology related with the Rivalia microscope combined with the Ngenuity. What is important, especially for the presbyopic surgeons, we don't need to refocus during the surgery. We don't need to view multiple sources of information, because the system is already capable of picture-in-picture and data fusion, where we can see the specs of our machines. And we don't need to use high amount of the endo illumination or microscope light, because the high dynamic range of the camera, which simply doesn't need too much light, which is safer for the patient. Of course, we know that we increased standalone 5 times the depth of field, meaning that mounting the Ngenuity camera on every microscope, it will boost the performance of the microscope. This is one important thing here, increased depth resolution. What is the idea of the depth resolution terminology? It means that in the all depth of focus range, everything is on focus, so we can see more on the structure from the structures of the eyes. So there is one thing which we are not often aware. It's called instrumental presbyopia, meaning that the depth of field of the microscope, the analog microscope, is directly dependent from the accommodation of the surgeon, meaning that the presbyopic surgeons are the ones which will most benefit from the Ngenuity, because the screen is actually a far vision, it's not our near vision. So don't forget about it. Younger surgeons might be happy with the analog microscope, but the surgeons which are approaching presbyopic age or are in the presbyopic age like me, I'm quite happy with the Ngenuity, which actually helped me to do a better job. So what is analog microscope image? It's a simple eye. Why simple? Because we cannot extract any additional data from that image. And what we can achieve with the Ngenuity and with the digital filtering or creating additional imaging modalities, we can count here at least 8 additional features of the single image, which we can incorporate in our surgical approach, and I believe that we might be better surgeons in that regard. So I just want to show you the depth of field of the Ngenuity in anterior segment. Since I'm a vitreoretinal surgeon, I often encounter combined cases, and you can see here that you can see the detached retina with fairly good details, and you can see also the anterior segment. And when you increase the magnification, you can see that the depth of field is still maintained, which is something not really valid for an analog microscope, because we know when we increase the magnification, we lose the depth of field. So here is a fundus enhancement filter which I developed 2 years ago, and it helps me to see better the details during the surgery. This is the regular chopping view, and you can see the pieces and their grayish borders. When you engage the fundus enhancement filter, they suddenly become transparent, meaning that you can see where to chop, how deep to enter, and basically or ultimately you will end up with a safer procedure. So I see this as a beneficial during cataract surgery. Also, contrast enhancement filter, a step that we are normally using in irrigation aspiration, where we need to distinguish between tissues with close transparency, meaning that they don't really have borders which we can distinguish in the classic view, but with the digital filtering we can enhance these borders and we can see better the details which are important for us. This is the level of magnification that you might achieve with the Ngenuity system mounted on a Revalia microscope. And this is a visionary edit a bit, in which you can see the simultaneous comparison between the filtered image and the image which is regular. We achieved that really difficult because we needed to mount the two Ngenuity systems on the same microscope. And you can compare in real time what is really happening and how the filtered image might be more beneficial for the surgeon. You can see on the left side is the classic, let's say, analog view. On the right side is the digitally filtered image, which is, in my opinion, more beneficial in terms of distinguishing subtle details during our surgical procedure. And the most important thing, this is done real time, meaning that it can benefit the surgeon during the surgery. It's not a post-processing or something else. So you can see here the capsule and the cortex, which are basically transparent tissues. You can distinguish them based on their black and white differences, basically. And you can see here the border of the rhexis on the classic image and on the filtered image. This here is something that I wish that we will have in the future, because when we filter an image up to now, we filter all the image and we lose a lot of details on the areas which are not at the moment interest for us. For example, here we can apply the fundus enhancement filter with different levels of intensity, and we need to see only the fundus and the rhexis where we are interested in the moment. But we lose details on the limbus and on the conjunctiva and the periphery. You can see the unfiltered image bears more data than the filtered one on the limbus and on the vessels. So in the future, if we might drag and drop the area of interest and we can apply the filter on that area, I think it will be better for the surgeon in order to have more natural perception for the rest of the tissues of the eye. For example, if I want to do an angle-based surgery, I can filter only the angle, but not the rest of the anterior chamber. So it is something that I wish Alcon will take note on it and will work on including that as a future capability of the already far advanced Ngenuity system. And as I mentioned, the angle, if we apply filters over the angle, we might extract more information regarding the anatomical borders and the aiming points which we need to utilize during our implantation of stent or a gonio-based surgery from other type. And here is probably the first anterior segment intraoperative fluorescein angioscopy. You might saw the exudation from the pseudo-exfoliative margin of the pupil on the previous image, and here this is a large cyst behind the iris, and this is just to show how good is the anterior segment fluorescein angio image with the Ngenuity without using any barrier filter. This is all done with digital filtering. Another image, autofluorescence filter. What can you tell me about the vessels? The vessels on the periphery, on the conjunctiva, can be used as seeing the blanching phenomenon during implantation of the stent of the angle. This is another image of the vessel autofluorescence under the conjunctiva of the eyelid. And just to show how good is the digital filtering of the Ngenuity. And then another thing to see here, which is you might be surprised, is the infrared imaging with the Ngenuity. I don't know, infrared imaging with the Ngenuity. This is example of mammography, meaning that the Ngenuity camera has so much dynamic range that it can detect infrared imaging. So you can see mammography intraoperative done with Ngenuity. it depends to be seen where we will use it in our surgery. And this is another interesting thing. We know that the vitreous is transparent, and with fluoroscopic visualization, suddenly we can see the vitreous in the eye. Me, as a vitreoretinal surgeon, I was amazed how much vitreous we might left in the eye because we don't see it. Here you can see vitreoretinal adhesion where I can remove it safely with high vacuum. You can see 550 without damaging the retina and creating additional iatrogenic breaks, because simply I can see the vitreous. Since Machemer introduced the vitrectomy, this is the main goal, to remove the vitreous. And last but not least, this is turning the Ngenuity from visualization system to intraoperative diagnostic tool and navigational system. Why? You can see here advanced proliferative diabetic retinal case. This imaging modality is achieved only with digital filtering, so no barrier filter is there. And here is an example of peripheral occlusive vasculitis. Basically, we knew, or we got the diagnosis intraoperatively because there was a hemophthalmos, and then this is an intraoperative fluorescein guided laser, so we can be more selective to treat the ischemic areas and to not damage the healthy retina. So for the first time we see intraoperative navigation like the neurosurgeons are doing. So I think this can be beneficial. During the surgery we saw a let's say embolus in one of the vessels, and we were not sure, is it embolus or arteriosclerotic plaque. The intraoperative fluorescein angio showed that there is a vessel perfusion. So with that said, I think that the Ngenuity is already far beyond the analog view, and I would encourage you to try the system. Thank you very much for the attention.